I'm Randy Shapiro, and I'm a neurologist. At least I was a neurologist. I'm a retired neurologist now, a clinical neurologist, and I got interested in multiple sclerosis a long time ago, and I actually created the first comprehensive MS center in the United States. And that was in 1976 in Minneapolis. And that center is now still there. It's called the Shapiro Center for Multiple Sclerosis. That was the first comprehensive MS center back then. There were a lot of MS clinics back then, and the reason I got into founding the first comprehensive MS center back then was a strange pathway that I took. I was on the faculty at the University of Minnesota, and as a resident in training before I joined the faculty, I was asked to participate in a course in the team approach to healthcare. And back then, in the 1970s, that wasn't a thing, the team approach to healthcare. It is today, but it wasn't back then. And I participated in this course, and the course got popular, and I ended up directing the course, and then I was hired at the university, and I decided that I would create an MS team, because there were none then. Universities are hard to do teamwork in, because you have fiefdoms. Everybody has their position, and they're all fighting for that. But when I left the university a couple years later, I founded the first comprehensive clinic in a private practice. It's a lot easier to do it there. And from there, things grew, and now we have over 200 comprehensive MS centers in the United States. And we have this wonderful consortium of multiple sclerosis centers, of which I was a founder and its first president. You know, managing multiple sclerosis is about three things. It's about disease management, managing the course of the disease itself. It's about symptom management, managing the symptoms that occur with multiple sclerosis. And it's about person management, managing the social, vocational, psychological problems that people with MS have. Those are three important things. When I started in multiple sclerosis, we had no disease management drugs. Couldn't manage the disease itself. And people said, diagnose and adios. And I really didn't like that approach. We really didn't have many drugs or treatments for symptom management either. We had to develop those, but they came first before the disease management. And then we had to look at the person who has multiple sclerosis, and people didn't do that very well either. When you look at all of those factors and how do we manage them all well, it really takes a team of people to do that. You need to have physical therapists and occupational therapists and social workers and nurses and psychologists and nutrition people. And it's a complicated disease because it has multiple problems, and no two people with MS are alike. So the team took off, and it's worked that way over all of these years since then, 1976 to now. It's still going on. So as I said, there are three things that we manage in MS: disease management, symptom management, person management. Let's think about that over the past 40 years, if you will. In the area of disease management, we went from having no disease moderating drugs, none, to having 25 or more different approaches to the pharmacologic management of multiple sclerosis. That's a major change that I've seen. In order to utilize those drugs, you have to make a diagnosis of multiple sclerosis. I always thought multiple sclerosis diagnosis was easy because I'm a clinician, and we didn't have tests. We did it by looking at the people and knowing what MS should be. That's a whole course in itself. But then came the MRI. And the MRI magically transformed the diagnosis of multiple sclerosis because you could see the abnormalities in the brain. The clinician has to understand that other things make those abnormalities as well. Strokes can make it, inflammation can make it, lupus can make it, migraines can make it, many things can make spots in the brain. Simply aging makes spots in the brain. But multiple sclerosis in the right clinical setting is one of the major causes of that. And so that allowed us to diagnose multiple sclerosis much earlier. And the earlier we treat multiple sclerosis, the better the outcome. So we've seen lots of changes then. When I started in multiple sclerosis management, we didn't have any symptomatic drugs. We had some rehab that wasn't very sophisticated, but we didn't have any drugs. And now we have drugs for spasticity, we have drugs for the bladder, we have drugs for depression, we have drugs for every symptom you can imagine. Some of them work better than others, obviously, and then we have rehab techniques that have gotten far more sophisticated. And for people who aren't ambulatory, the wheelchairs and the devices that we use have gotten really great to allow people to function. I have a mantra. The answer to disability is mobility. The answer to disability is mobility. I try to work that into everything I say. The answer to disability is mobility. And so we try to keep people mobile. And I don't care whether they're mobile with a wheelchair or with a walker. Obviously, we want them to be mobile at the highest level possible, but they have to stay active. They have to stay active. Cognitive problems are such an issue with multiple sclerosis in some people. And you'd say, well, what does mobility have to do with cognitive problems? But I want you to think about that for just a short time. If you're not mobile, you stop going out to eat, you stop going to movies, you stop going to church, you stop going to here and there and everywhere. And that brain is not a muscle. But if you don't use it, you will lose it. And so when you get mobile again and start doing things again, surprisingly, that brain wakes up and people have less cognitive problems with that. So even with cognition, mobility is important. We've gained a lot with that. And in the area of dealing with the person with multiple sclerosis, we've come to recognize the issues. I wish we had better treatments for it, but we've come to recognize the issues. There are medications, there's counseling, and we've learned a lot about the neurochemistry of the brain in depression and in disease. And so we've made a lot of changes. I've seen a lot of progression in my 45, 50 years of multiple sclerosis management. This is the era of MS management. We're improving every day. I started a center in Minneapolis called the Multiple Sclerosis Achievement Center. It was a center for really disabled people. Everybody had significant disability in wheelchairs. They came once a week for the whole day. We had 200 people coming once a week for the whole day for PT, OT, speech, things of that nature. It's maintenance rehabilitation. It was not covered by insurance. We had to have it covered by philanthropy and medical assistance and things of that nature. But when we started the center, people didn't want to go. After they went, they didn't want to leave. But the caregivers would come to me after about 6 months and say, you know, the person I'm caring for, spouse, significant other, got smarter. I don't understand that at all. We're not giving them noni juice. Why are they getting smarter? And I looked in to see why they were getting smarter. And it turned out that it's because they weren't talking. They were isolating themselves, and now we were forcing them in a social situation. How are the twins doing? What do you think about the weather? What do you think about this or that or the other? Not complicated questions. If you don't use it, you lose it. And they got smarter just by simply being at the Multiple Sclerosis Achievement Center. That center is still going on. It's metastasized now, so there are achievement centers in Sacramento, in Los Angeles. There's one in Denver. They don't call it that, but it's in Denver. The ones in Sacramento and Los Angeles call it Achievement Center. There's one in Rochester, New York. There's one in several different places, and so very proud of that. Well, as I've been saying probably a little ad nauseum here, I think it takes a team to manage multiple sclerosis appropriately. And unfortunately, we're living in an age where insurance sort of dictates your team and how you use it and when you can use it, and that's very frustrating to many of us, and we'd like to see many changes to that system. I truly believe that even if people who have mild MS could benefit from learning some physical therapy exercises, not seeing the therapist on a regular basis, but learning and dealing with that, and having a team available to them to be used as necessary. There are some MS teams that want to see everybody every visit. That's not very practical. I think somebody has to triage people to the right person at the right time, and that's usually the neurologist or, in some cases, a nurse practitioner who is very well educated in multiple sclerosis. I really like the concept of a wall-less team, if you will, where you don't have walls, where in a private practice situation, a neurologist has a physical therapist, not necessarily on site, but one that he or she knows and who knows multiple sclerosis, and an occupational therapist, and a speech pathologist, and a social worker, and whatever, a psychologist, psychiatrist, urologist, whatever it happens to be, and that these people talk to each other. It's important to communicate about what they're doing so that you really do have a team without walls. And I think that's economically feasible. Sometimes it's not the most practical because everything is in a rush today. But you know, this is the golden age of multiple sclerosis management. We have these drugs, we can manage the symptoms, we can take care of the person, and we're seeing it being done. Well, if I were to look at the main thing I'd like people to take away, I think by now you could probably tell. The answer to disability is mobility. The answer to disability is mobility. And that's, I want people to understand that we are in the golden age of MS management. We have numerous medications that we can choose from. We have numerous physical treatments to utilize. We have psychological skills. We have organizations that are backing this up, whether it's the National Multiple Sclerosis Society, the Multiple Sclerosis Association of America, the Multiple Sclerosis Foundation, and importantly, Can Do Multiple Sclerosis, which is an organization that I'm heavily involved with these days, that are looking to allow people to do what they can with what they've got. Do what they can with what they've got. This is the golden age of multiple sclerosis. People shouldn't be down on the ground about the diagnosis of MS. They should be active and mobile. The answer to disability is mobility.